taking a good history is crucial to diagnosing conditions accurately and providing patient-centered care. Nurse practitioner students who have been working as nurses may be familiar with history taking. But as nurse practitioners, we need to dive into history taking even further because we use the information to diagnose and navigate treatment plans, including prescribing medications. In this episode, I will discuss how student and new grad nurse practitioners can improve history taking skills by using SOCRATES acronym. Hi, I'm Miki Miura, a family nurse practitioner in Hawaii. I've been practicing in women's health field for 10 years and also precept nurse practitioner students. And I found that SOCRATES acronym is very helpful for nurse practitioner students and new grad nurse practitioners. So in this episode, I'll teach you how you can use SOCRATES acronym so you can take a good history. By the way, did you know that 79 to 90% of patient diagnoses are made on history taking alone? So it's critical to learn how to take a good history to diagnose conditions correctly and come up with safe and effective treatment plan. Good history is thorough, but also pay attention to patients' concerns and thoughts. So there are multiple layers to improve your history taking skills. But in this episode, we will focus on using SOCRATES framework for assessing symptoms to accurately diagnose conditions. If you haven't watched the episode on using body language effectively to facilitate good communication with patients, you should watch it also. I will put the link in the details section. SOCRATES acronym is commonly used to take a comprehensive pain history, but this can be used for other symptoms also. And I will show you how it's used in my women's health practice so you can picture how it's used in an actual practice setting. First letter in SOCRATES acronym is S, which stands for site. It's important to specify exactly where the pain and other symptoms are located as much as possible. Patient may say, I have stomach pain. Then you can follow up, is it on the right side, left side, or in the middle? Is it above or below the belly button? Or do you feel it all over? Some patients may have difficulty describing where they feel the symptoms. Then I usually ask them to point the area with their finger. In women's health, we may encounter cases where patient notice breast mass or pain. We need to ask where exactly the patient feels the symptoms. Is it generalized or specific to one location? Next letter in SOCRATES acronym is O, which stands for onset. When did it start? How did it start? Was it when they were doing certain things or after certain events like car accidents? You may ask patients, when did you start feeling the pain? How long ago did you notice that? When was the first time you noticed it? When symptoms are intermittent, some patients may get confused about whether you are asking them the very first time they felt the symptoms or the most recent episode of having the symptoms. This information is very important, so I usually repeat what I think I heard from my patients to summarize and make sure I understand them correctly. And this will give patients an opportunity to correct me if they mean differently. So I may say, so irregular period started after you gave birth to your first child when you are 27 years old. Is that correct? Next letter in SOCRATES acronym is C, which stands for character. How would you describe the symptoms? Is it constant or does it come and go? Next is the character of symptoms. If it's pain, you can ask, is it sharp, dull, pulling sensation, or stabbing sensation? You should also ask about the frequency of symptoms. Is it constant or intermittent? And note here that in our chart, we may note constant pain or intermittent or occasional pain, but when we ask questions, we should use simpler words like, do you feel it all day long? Do you feel it every day? Does it come and go? So patient can understand the questions better. Next letter in SOCRATES acronym is R, which stands for radiation. Do the symptoms move elsewhere? This question is particularly relevant to pain, but also some other conditions like skin conditions. For example, you may ask, did the rash spread elsewhere in your body? And note that this question might not be applicable to all symptoms, so you may skip this point for certain conditions. I hope you are enjoying this episode. Before we go back, I want to quickly mention that I'm giving a gift to you for listening to this episode. I'm giving a free PDF nurse practitioner job interview prep checklist. This checklist is full of questions that you're likely to be asked during job interviews as a nurse practitioner and some tips on how to prepare for them. With this downloadable PDF, you can prepare for interviews so you feel confident and stand out from other candidates to get the job that you really want. To get this free PDF nurse practitioner job interview prep checklist, you can go to usa.jnpproject.com/interview. Again, usa.jnpproject.com/interview. Now, let's get back to the episode. Next letter in SOCRATES acronym is A, which stands for associated symptoms. Do you have any other symptoms relating to this? Associated symptoms may be directly related to the main complaints that patients have or may be unrelated to them. Either way, getting information about other symptoms is very important to come up with differential diagnosis. In the reality, patient may not tell other symptoms if you only ask, are there any other symptoms associated with this? Because they may not be able to tell which symptoms are related to each other or which is not. So many times, you need to actively ask specific questions. By this time, you should have some differential diagnosis in your mind based on information you got so far. And by the way, this is an important thing to note. One of the biggest differences in history taking when you are a nurse versus a nurse practitioner is that as a nurse practitioner, you immediately start thinking of differential diagnoses when you're taking history. You're not randomly asking questions. You have specific purpose for asking questions, which include diagnosing conditions, so keep that in mind. Differential diagnoses should include diagnoses that can be life-threatening and dangerous if you miss them, such as cancers. We should also include common diagnoses associated with symptoms. For example, 28-year-old female comes in for lower abdominal pain for 1 week. You may consider ectopic pregnancy, which is pregnancy happening outside the uterus. Ectopic pregnancy can be life-threatening and can cause lifelong harm to patient's life, such as infertility if it's not treated early. In this case, I may ask, how's your period? When did your last period start? Did you have any vaginal bleeding? Are you on any birth control? Are you sexually active? To check to see if the patient has symptoms that are commonly seen with ectopic pregnancy. Patients may not give you this information if you don't ask them specifically, because they may not think that these are associated symptoms. Next letter in SOCRATES acronym is T, which stands for time. How have the symptoms changed over time? To ask about the time, you may use questions like, how have the symptoms changed over time? Is it gradually getting better or worse? I usually ask this question right after I ask about the onset of symptoms and characters, because I think it flows better. For example, when I ask about painful menstruation, I may ask, so you said you have painful periods. When did you start to have painful periods? When was the first time? Are your periods always painful or pain comes and goes? So you said it's getting worse. Do you mean that it happens more often or the severity of pain got worse, or both? As you can see, you don't have to follow the exact order of SOCRATES acronym as long as you cover all the aspects of assessing symptoms. If different order works better for you, that's fine. You may also change the order of questions based on how patients respond to you. Next letter in SOCRATES acronym is E, which stands for exacerbating or relieving factors. Does anything make it better or worse? This includes lifestyle changes like diet or changing activity levels, like stopping heavy lifting or participating in certain sports. This also includes medication and other treatments. For example, in my practice, when patient comes in and complain about irregular period, I may ask, did you try anything to make it better? Did it actually work for you? Were there anything that made it worse? Oh, so you tried birth control pill in the past, and when you're on it, your period were regular. Oh, great. Again, you may have to give examples or ask specific questions so patients understand what you are asking and how they can respond better. Last letter in SOCRATES acronym is S, which stands for severity. How severe are the symptoms? In this section, you can use on a scale of 1 to 10, where the 10 is most severe. But note that the pain scale is very subjective to each patient. One patient's 8 may not be equal to another patient's 8, but it can be helpful to assess how severity of pain has changed over time and how patients perceive the pain. I also use scale of mild, moderate, and severe to simplify the way patients express the intensity of the symptoms. For example, for pregnant women, I may ask, how's your nausea? Would you rate it mild, moderate, or severe? I also would ask patients if they tried any medication to alleviate symptoms and if the symptoms affected their daily lives. As I said before, pain scale is very subjective, and the information alone may not be as helpful as we use other information in addition. Pain is subjective and pain tolerance is different for each person. We shouldn't deny the patient's subjective rating of symptoms, but additional information such as trial of medication to alleviate the pain may be also helpful to assess severity of symptoms. So we just reviewed the SOCRATES acronym for assessing symptoms. Again, the order of asking these questions can be changed, but the most important thing is to assess all these aspects so you can get a comprehensive assessment of the symptoms to reach an accurate diagnosis. I hope you like this episode. If you like it, please give me a thumbs up and subscribe to my channel. If you have any comments, if you want to share your experience or opinions or any requests for future episode, please write down in the comment section. Alright, I'll see you in the next episode. Take care. Aloha.